So, my name is Sian Ellingworth, and I'm the founder and CEO of Buddies for Life. And we make oral care products for people who are unable to use conventional products for a wide range of reasons, which might be because they're neurodivergent or they're living with a condition such as dementia, or other disabilities. It means a huge amount for us to be a finalist or semi-finalist in the Care Innovation Challenge. I came to the event thinking I was pitching a product, or a product range, and I didn't really understand the extent of feedback that I would get that's really shaped what we're doing. So having the input, different perspectives from people who are real experts in the industry from all different perspectives is huge. It's made a huge difference. And to get that appreciation and recognition that what we're doing is important has meant everything to me. So the innovation, the Senses Moisture Care range, it's a range of sensory-friendly oral moisture products and designed to improve the comfort for people living with dry mouth or experiencing it, particularly at end of life or when they're receiving palliative care. And it might be due to the medication that they're on, or because of the stage of life that they're at, or they're living with dementia or unable to carry out their own oral care. But in those situations, people are often extremely uncomfortable with that, causing real discomfort, and they might not be able to speak properly or swallow properly. So it's really critical that they're receiving the right level of moisture care. And traditionally, the products that are available have a number of issues associated with them, such as high glycerin, which has been known to draw in moisture from surrounding tissues and actually make the condition worse, or they taste bad, or they're not pH neutral. So our product range has been designed to correct all of those issues, to address those issues, and provide something that's really comfortable to use for the end user, and for the carer, that they're easy and convenient and safe and hygienic, and eco-friendly too. So rather than developing the solution in isolation, we've worked really closely with carers, clinicians, and care providers to create the formulation. And now we're doing that to also understand what is the best format to apply it in. And so the aim is to make assisted mouth care really comfortable, more dignified, and easier to deliver, helping improve quality of life during some of the most vulnerable moments of a person's life. I applied for the challenge because I was at the care show and I met the wonderful lady who is in charge of the challenge, and she was explaining all about it. And I just thought it was the most fabulous idea for me to be involved and have the opportunity to listen to other people who are doing similar things, and of course those experts who are involved in the challenge. So I wasn't sure that I would be accepted, but I thought it was such a great opportunity. So the biggest lesson from the challenge for me has been not to assume that one format suits everyone. So I came with a particular format in mind, and I realised during the weekend that I'd fallen in love with the solution that we'd come up with to this issue of ensuring really good moisture care at end of life and with palliative care. And I needed to remind myself, and what the weekend did for me was remind myself that we need to stay in love with solving the problem, not with becoming fixated on one particular solution. So the format that we were initially going with was a snapstick format that would deliver this formulation that we'd come up with and we've applied for a patent for. But the formulation, listening to everybody that weekend, I just realized this might not be the only format and it might not be the best format or the most affordable one. So let's re-engage all those people, all those experts in the sector, and the users are experts. Let's re-engage and understand and listen and develop. And that has really been invaluable. I think the concept of innovation in the care sector is really all about looking at something from different perspectives. So, really listening, engaging, hearing how people view what you're doing, what the problem is from their perspective, and then taking that feedback and and developing what you're doing so that it's really meeting those needs. I think that is really innovation. Okay, what I would say to anybody considering applying for the Care Innovation Challenge in the future is absolutely just do it. Why wouldn't you? There is so much to be gained, everything. And even if you don't go on to be a finalist or win, you will get so much out of it. Just do it.
Brilliant.